He is my whole world, so incredibly precious. But my wrists, they burn every time I lift him. Right here. I tried the brace, I tried to rest, but he needs me. And now the pain is so sharp, I'm scared I won't be able to hold him.
If you're a new mom with wrist pain, that feeling is real, and that pain has a name, the Quervain's Tenosynovitis. It's an overuse injury where the thumb tendons and the tunnels surrounding them become inflamed from the constant lifting, holding, and gripping that comes with a newborn. When it doesn't go away, most people start thinking about getting a steroid shot. And here's what most doctors don't have time to explain. The shot can take the pain away and it works fast. The problem is pain relief and actual healing are two very different things. That's why so many people feel better, go back to normal, and watch the pain return. In this video, I'll walk you through what a steroid injection actually does to your tendon, why the relief doesn't last, and what it actually takes to heal the structure. Let's start with what steroids are genuinely good at, because the relief is real. When you have the Quervains, your tendon and the sheath it glides through become inflamed and painful every time you use your thumb. A corticosteroid injection goes directly into the pain area and shuts down the inflammation fast. But here's where it gets complicated. Reducing inflammation is one thing, rebuilding a tendon is another. To understand why the shot doesn't last, you need to know about how tendons are designed. Tendons are packed with parallel collagen fibers. Think of them like tightly wound cables built for tension and load. But unlike your muscles, tendons have very few blood vessels. That's actually by design. A dense blood supply would disrupt the fiber alignment and make the tendon weaker. But the trade-off is steep. Very little blood flow means very little oxygen, very few nutrients arriving to repair an injury, very little ability to flush out cellular waste. This is why tendon injuries heal so slowly, and why the tendon can't really fix itself. And here's what most people are never told. Steroids don't just reduce inflammation, they also inhibit collagen production, the very process your tendon needs to repair itself. So the inflammation may go down and the pain disappear, but the underlying damage still there. And now, harder to fix. Think of your tendon like a bridge. If the structure is damaged, you don't just stop at clearing the debris, you rebuild the bridge. A steroid shot clears the inflammation, but it doesn't rebuild the structure. So when you go back to lifting your baby, you're using a bridge that's still fragile. And if you load it too early, those collagen fibers don't line up neatly. They become disorganized and clump together. That's fibrosis, and it makes the tendon weaker. What's worse is repeated injection carries serious risks, tendon atrophy, skin discoloration, and the pain coming back with greater intensity. For this reason, most clinical guidelines limit corticosteroid injections in tendons to 1 or 2 maximum. So what should you do? First, change how you use your wrist. You don't have to stop holding your baby. Just stop using your thumb as the main lever. Use your forearms and engage your core to scoop. Shift the burden from the wrist tendon to the larger muscle groups. This alone can significantly reduce the repetitive strain on the tendon sheath. Then, start rebuilding simple thumb exercises. Even something like a rubber band works. Put a rubber band around your fingers and open it outward. Extend the thumb and open it back. That controlled resistance is exactly the kind of signal the tendon needs. It's not dramatic, it's not fast, but this kind of small load exercise is the only mechanism that drives real structural recovery. But what if the pain is too strong to even start? That's where pain control matters, not by shutting down the body's healing response, but by facilitating it. This is where acupuncture can help. By needling specific points around the tendon of the wrist, it can improve local circulation, reduce pain, and most importantly, mechanically stimulate the tissue repair. Studies have shown the mechanical stimulation of the needles actually activates the collagen generation in the tendon. So instead of blocking healing, acupuncture helps support it. It's not a replacement for rehabilitation. Think of it as a way to tolerate rehab better and recover faster. Now, if you've already had a steroid injection, or if you're going to get one, I want to be clear. It's not automatically the wrong choice. For severe pain, for someone who genuinely can't function, it can be useful, but it's not a treatment for the underlying cause. Whether you get acupuncture or a steroid shot, once the pain decreases, you need to do resistance training for your thumb. A shot can silence the pain, but silence doesn't mean healing. If it worked but the pain came back, now you know why. If you want it to actually heal, you have to treat the structure, not just the symptom. I hope this felt like a little tour of the Metropolitan Museum of Art and the art of healing. I see pain in the artwork. Some pains are timeless, even when they are not painted. Wrist pain from holding a baby has probably been around as long as mothers have. My art of healing is acupuncture, and I'm just a few blocks away from here. I'll see you in the next one.